Next, we have on the agenda House File 4563, which is a Representative Bang committee. If you'd like to come down, please. Because Representative Bang is not a member of our committee, I move to lay over House File 4563. Chair Bang, welcome to the committee, and please introduce your bill.
Thank you, Mr. Chair and members. This bill continues to build on our work to address the mental health workforce shortage. Section 1 creates a mental health and substance use disorder education center within the Department of Human Services. So there's an entity truly focused on our workforce. The center can analyze data, engage high school students, and identify barriers to licensure, help people understand the different MH and SUD professions, and more. We base it on the model in Nebraska, whose legislature passed it in 2017. And so in those 10 years, they saw the number of providers increase by 39%. Section 2 adds that the program pays for supervision for people working towards licensing in targeted rural areas of the state, and to also organizations serving underserved populations. Section 3 establishes a training program for people working with youth with a mental illness. There are not enough services for our children and youth, and especially not enough residential treatment beds. Hiring and retaining staff is the most critical element needed to rebuild capacity and help children and families with the highest needs. Training for new staff is incredibly important as we want to teach, equip, support, and prepare new staff to deliver quality, clear care to our vulnerable children with high levels of mental health symptoms. This section will increase statewide access to training cohorts, and in doing so, accelerate overall access to children's mental health treatment. This model is based off existing training provided by the Center for Advanced Training and Child Welfare at the University of Minnesota. Section 4 closes the gaps for people who have graduated with their master's degree to be a mental health professional, have finished their practicum, and haven't taken or received the results of the national test. So this specific gap prevented providers from being able to bill for the treatment they provided. And with that, Mr. Chair, I also have Sue from NAMI who can also add further to my testimony.
Thank you, Chair Bang. Sue Abderholden, welcome to the committee. Thanks for being here. Please introduce yourself and begin your testimony.
Thank you, Mr. Chairman, members. Sue Abderholden, Executive Director of NAMI, Minnesota. And I really want to thank Representative Vang for her continued advocacy in addressing our workforce crisis. And it is a huge crisis. We know that people are waiting months to be able to access therapy appointments, psychiatry appointments. We know that sometimes we have to take beds offline in children's residential facilities, adult IRFs facilities, and even hospitals because there isn't the staffing. You did do a lot of good things last year that really kind of helped, and so this just kind of adds to it. I think the Workforce Center would be really helpful because then we're really focused on it, right? We're measuring kind of progress that we're making sure that high school students know that this is a viable and interesting and rewarding career. We know that paying for supervision has been a great addition. Paying for supervision on top of your student loans and everything like that was really prohibitive for many people, and about half of the people never went on to get their license because they couldn't pay for supervision. But we also wanted to make it clear in the statute that it includes rural areas as well. Aspire has really worked hard to focus on the Youth Training Institute, and I think it's another great idea to kind of professionalize that work and get more folks in. And then the last one is really, again, a policy issue with no fiscal note, but if you were in the midst of your practicum and supervision, then you could bill. But as soon as you finish those hours and were waiting to take the test or waiting for the results, then you couldn't. And so that's just kind of an odd gap that we just really need to close. And again, there's no fiscal note to that. So I would just urge your support of this bill. Thank you.
Thank you so much, Ms. Abderholden. Is there anyone else who would like to testify on the bill? Not seeing any members. Any questions or comments? I see Representative Baker first, and then Representative Engen.
Thank you, Mr. Chair. Thank you, Representative Vang, for this. I really do like this idea. This is a great concept to get more young people into the thinking of how can we help more people in this area. And this may not be a question you can answer because, again, there's no fiscal note yet. If there was a fiscal note, or what does the Department of Health think this is going to look like? If it is something that we establish, is it full-time equivalents? I guess I'm just trying to think, how big is this scope going to be? Is it 5 full-time employees? Is it 10 full-time employees to build this up? What would be that idea of what the MDH is going to be thinking about, what this will take to get it stood up?
Representative Bang.
Mr. Chair, and thank you, Representative, for your question. There's no fiscal note attached to it yet, and so I can't give you an exact number, but I'm definitely open to seeing what that could look like and hearing feedback from the department as well.
Mr. Chair, and I only offer up only because I didn't expect you to maybe have that yet, but it's a really good concept. I think it's an idea that we can work towards. I'd be happy to work with you on this. Again, that community of mental health, especially with SUD, is so underfunded right now. We need to do more to get, I think, our foundation built up with some real good rate reimbursements to get them competitive. These are always good ideas, but we got to start with our foundation. We got to start where we really need it today to save people today. This is very good long-term stuff. So I appreciate you bringing the bill forward, and I look forward to working with you on this. Thank you.
Thank you, Representative Baker. Representative Engen is, nope, okay, very good. Next, Representative Edelson.
Thank you, Mr. Chair, and thank you, Representative. I just want to, I mean, the last part of this bill, while it seems small, lines 4.16 to 4.19, it's a huge gap, and I just want to thank you in terms of the licensure and just the gap that happens in the clinical world. So thank you for addressing this, and thank you to Ms. Aberholden for that. That's a good catch.
Okay. Thank you, Representative Edelson. Any other further comments or questions? Not seeing any. Chair Bang, any closing comments you would like to make?
Thank you, Mr. Chair. Just want to thank you and the committee for their time and your support.
Thank you very much, Chair Bang. With that, I renew my motion to lay House File 4563 over for possible inclusion. Thank you.